Hey, welcome back, everyone. I hope my voice is clear today. This is going to be day 4 today for the NGN-style questions case studies. So, good morning, some of you, and good evening as well. We are live right now on 2 different platforms, Zoom and also on YouTube. And I really want to say thanks to everyone for whoever is joining at this time. Because I bring this session a little bit early today because my little baby is not quite feeling well at this time, just so you know. So I really want to say I will try my best as much as I can to do it today. Okay. Probably session might gonna be a little bit, maybe within half an hour, maybe 40 minutes. I'm not quite sure yet. But I will try my best to make it possible as much as we can do it today. Okay. I really want to let you guys know this thing ahead of time, just in case you might be wondering why we are joining early today and why we left maybe early today as well. But we'll try our best. So maybe another day we'll stretch more hours so you can study more hours with me. Probably today, maybe less time. Okay. So in today's class, we are going to discuss the case studies, right? And this is the day 2 on case study strategy. I already make one video yesterday. So we done one class yesterday as well. Those who missed my class yesterday, just in case, highly recommend to watch that lecture because I talk a little bit more about case studies in there as well. And also there is another video about 3 months ago. I make it on case study as well. So maybe watch those 2 videos because I already mentioned about the introductions in there related to how much you need to study for the case studies, especially if you're writing down the NCLEX examination. Now, in today's class, we are only going to practice the questions, and those who joined yesterday, they already know that in today's class, you are going to try your best to participate along with me, right? So you can find out the answer with me as well at the same time. Okay. Now, this is the first case study, what I'm bringing out today. And probably this is the only we're gonna study today as well because it's already has 6 questions in total, right? Now, when you get the case studies like this in the exam, like as I mentioned yesterday, before you jump into right away, in the case studies, it's better to read the question first, right? So this first case study, if you notice, it has like 6 items in total, right? I hope my screen is visible. It's not too small for all of you, but you can let me know as well. I already make a zoom for you as well. So in this case study, if you notice, this is the information they give it to you, like health history, and you got some assessment, and then you got some vital signs at the same time. So in the real, you can say in the examination or when you're practicing using softwares as well, you will be able to click each of them and see the information. But this is just like a dummy, right? Which I have with me right now. So I'm not able to click on it, but I really want to highlight it for you as well at the same time while I'm talking about it, right? Now, the first thing, if you notice the brief information, just history, assessment, and vital signs, right? I have not read any of this information yet, right? Because I want to see the question first, right? So when you go down with me to the question after the vital signs, right? You will see on the next page with me, there is a first question related to this case study, right? Now the question, if you notice, they said, select the top 4 findings below that require immediate follow-up. When I see the word immediate, I get very alert at the same time as a nurse. You always think, why they give me the word immediate? Is it something really urgent? Something in emergency? I have to pick up that thing right away immediately in there. I cannot wait for that, right? So when I see this word, this is how I will think about it, right? And if you notice, they will give you some, like in this question, they have already give you some, maybe some sign and symptoms, right? This is almost, I can see here, cough, edema, crackle, respiration, pulse oximetry, blood pressure, shortness of breath, and even maybe something related to history, maybe of the client, like inability to afford the medication and history of chronic stable angina. So once you read like that, then you actually know what are you looking into case study, right? So I highly recommended everyone, like, get a brief idea of the question first and then look into the case study. Now, to make it easy, right, what to look in case study and how, right? Again, I find like a pattern, right? And I noticed that respiration, pulse oximetry, blood pressure, even I would say shortness of breath also. For that, I'm going to look at the vital signs of the patient as well, right? So when I say four keys like this, I'm going to look at the vital signs for them. But when I see cough, edema, crackles, and point number 8 and 9, I will look maybe something into history of the client, assessment, history. This is something I need to look, right? So once you got the idea, everyone, right? Then after that, go back to the case study, right? Now, again, going back to the case study in here, so you can read along with me and try to understand how to find out the answer. I'll give you guys the mics as well if needed, right? Let me see here. Whoever wants to participate, you can come forward as well. Let me give you guys the mic first. Just give me 1 second. Okay, sometimes it's tricky for me to find the options right away. Excuse me. Okay, I find it option. Now you guys are unmute already. Just in case, whenever you want to participate, feel free to open up your mic and you can participate with me, right? Now, if you guys see here, health history, they give you like a small paragraph. This is how I will read about this information and maybe make only two maximum points out of it. Something like a conclusion, concern, immediate, which I need to think about it for that question. So when I see health history, age is not important for me to see that. But yeah, I can see here come to the emergency department after feeling shortness of breath. Excuse me. So that means that's the reason, like why the patient comes over here today and having a cough for the past 2 days, right? So this has already been 2 days. Maybe not that emergency right now, but right now, if the shortness of breath is still there, then yes, definitely, I'll think about the airway, right? Now, the client reports sleeping on the two pillows and waking up the coughing several times in the nighttime. Okay, so you highlighted that stuff as well. And then after that, you have expressed the feeling very fatigued lately and spending most of the day in the chair. I'm not concerned about that too, right? Because this is not something an emergency for me. I have to look into there right away. Client appear anxious, okay? And this is the history they give you, the background information about the client. And I can see some name of diagnosis here, right? Then after that, they said the client expressed concern of inability to afford the current medication. Seems like your patient is not able to get the medication right now, right? So this is something I got the idea, right? And I'll make only 2 points out of it. On the piece of paper, what they give you in the real exam in the NCLEX, always use that. The whiteboard paper, whatever they give it to you, pen, pencil, write down on that paper like two maximum points, right? From this small paragraph. So your brain can be connected and you know what exactly you're looking in there. So maybe in 2 points, I will just write down maybe shortness of breath, SOB, question mark, right? Like, is it still there or not, right? And then after that, maybe I'll just write it down. Cough, maybe, question mark. Not taking medication, question mark, maybe, right? So 2, 3 points like that. And then I'm done with this point, right? After that, when you see the assessment, right? Now in the assessment, you try to look into something where exactly you're looking into the question, right? So I'm not concerned about oriented because patient is okay, right? Oh, crackles is there. So I want to think about it for sure. So write down on the piece of paper what they give it to you again, right? I'm not concerned about this too. I'm not concerned about the bowel sounds at the moment for this one too, right? Some edema is also there. I can see that, right? So maybe that's something you want to relate with the crackles and everything. Okay, maybe shortness of breath, what you just read maybe on the top, right? So make a relationship, right? And then after that, you look at the vital signs, right? You think if it's a fever, there is not, right? Oh, tachycardia, right? Patient is trying to breathing faster a little bit at this time. You look at the blood pressure at the same time. Oh, 89 oxygen right now, right? So once you got the idea like this, and then go to the question after that, right? If somebody needs to write down this value vital signs, feel free to write down on your piece of paper right now before you pick the right answer. If anytime you want me to go back to the top screen again, let me know so I can show you what information exactly you're looking into there, right? Now this is the time to find out the top 4 findings which you think it's concern for you, emergency for you, and you want to look into that right away, follow up, right? Now, feel free to use your mic, everyone. As you know me, I always tell everyone, come forward if possible, use your mics, right? Tell me which answer you want to pick up in here, then I'll tell you my answer key at the same time, okay? Anyone, whoever is willing, feel free to come forward, please. Let's think about
Madam,
it here.
madam, I chose
Yeah, yes, Gurpan.
shortness of breath,
Okay, shortness of
pulse,
breath for you. Then
pulse oximetry,
Pulse oximetry.
pulse oximetry for some students. Very good. Then
cracker, crackers,
crackles. Okay. Anything else?
Typified.
and
Blood
Blood
pressure.
pressure.
Blood
blood
pressure
pressure.
too.
Yes.
Okay. If you say blood pressure, why not the respiration then? This is my question then. Which one do you think it's more concerned, respiration or blood pressure here?
Ma'am, airway is the most important way
There you go. So
to
what do
rule
you
out
think,
the patient.
Sammy? Which answer we should pick as the last, number 4?
Respiration might be.
Respiration, right? Be confident, right? You always want to think about the airway, right? Those who are thinking like, oh, blood pressure is also concerned at this time. We also need to see that as well. Oh, coughing is also concerned at this time. Like everything is concerned. Patient cannot even afford the meds right now as well. But you know how you need to think? Like you enter in the room, for example, and you have 9 things in front of you, right? And out of those 9 things, which one you think is the top 4 is on the list? You want to handle them first quickly right away because that cannot wait, right? So for if you think like that, you will come up quickly with the answer. You will be like crackles, respiration, pulse oximetry, shortness of breath, right? So this is how you're going to pick up the answer faster for this question, right? So I hope everybody understand how I handle this question in here. Anytime, any doubt, you can always stop me in between or use your chat boxes. Doesn't matter. YouTube students, you can also use your chat box as well. I'm always looking at the questions for you at the same time, right? Now, moving on to the next question quickly, right? So when you go to the next question, you will be like, they give you same almost case study. So you don't have to read this one again, right? But if you see anything different here, that definitely you need to read it. Assessment, same assessment, right? Vital signs, okay, same vital signs. I don't think so anything changing in here too. So that means nothing really to read into there, but just look at the question, right? So when you see the question now, it says, nurse recognized that crackles throughout the lung in this client is due to what? And that is related to what? So this is like drop down menu type of question. What does it mean? So in the real exam, everyone, when you will click on this arrow, right, you will see either 2 option, 3 option, 4 options under that. It's like a fill in the blanks, you can say, and you have to pick up the answer out of that. One score definitely for each. If any of them is wrong, score is 0 for that particular point, right? So in this case, as I cannot click on my dummy, so I'm going to give you guys an option in here and you guys decide then what's the answer with me. Okay. So for the first fill in the blank, for this one, I'm going to give you the first option here is fluid accumulation. Fluid accumulation. So if you want to write it down on your side, that will be great, because sometimes my cursor is not working that good and I cannot type exactly in there, right? So fluid accumulation, right? This is something, the first option I give you for the first fill in the blank, right? And then after that, the second option I give you here for the first fill in the blanks, same thing for the first one, is infective, infiltrate, infective, infiltrate, infective, infiltrate. So this is my second option I give you here for the same fill in the blank for the first one. We are still on the first one. Okay. Infective, infiltrate. My handwriting is not really good on the board. Highly recommend to write it down. Use your pen, pencil, paper right now. The first option I give you fluid accumulation. Second option I give you infective, infiltrate. Now, here second fill in the blank. I'm going to give you the first option is heart failure, heart failure. And the second option I'm going to give you is what? Pneumonia. Pneumonia. Who gonna tell me the answer for this question? Let's see. Then I'll tell you guys my answer then.
Heart
Madam, fluid
failure.
fluid
Sorry.
Fluid
accumulation
accumulation is
Okay.
due
lead
to
to
heart
heart
failure.
failure.
Fluid
Inflammation due to heart
accumulation is
failure.
due to heart failure.
Yes.
Okay.
Definitely, ma'am.
Now, how did you find out this answer? Gulfam, Sammy, or any other student?
Ma'am, earlier, as much as we have observed the patient and his fluid
And
accumulation
crackle
mostly
sounds
comes
because crackle.
Crackles.
Because of crackles, but crackles you can also say in the pneumonia also, no?
definitely, ma'am, but the fluid accumulation, when we have
Madam,
given the key,
Did we
Still
notice
sound
any sign
NCT
of
edema also
infection
is there,
somewhere?
ma'am.
Anyone? Did we notice any sign of infection in the case study?
no, ma'am.
Then
No.
we do
no.
not want to think about the pneumonia. Very good. See, you pick up a one clue somewhere, right? And if you know that I need to see infection also at the same time in pneumonia, that will correlate with my infective infiltrate at the same time as well. So if I don't see that, why would I pick that answer? That means the only left answer now you have is the first option is fluid accumulation, and the second one is related to the heart failure. This is how you find
And
out
madam,
the answer for
patient
this
use
question.
two pillow. Patient use two pillow when he or she sleep.
Yeah, that gives you also the idea of the positioning of your heart failure patient at the same time. Like patient is not able to breathe enough due to a lot of fluids in the lungs right now, right? Any other question at the moment? All good? Okay. Now, if there is no question in here, let's see the next question right now. Those students who are writing exam this month, I can see some of you are typing right now. Try your best to come on the mic. Okay, this month, next month, students, you really want to try your best to participate. Doesn't matter, you know the answer, you don't know the answer. The more you're going to learn with me, the more you're going to understand how to solve the case studies, right? Now, the third question related to case study, but before we see the question, if you guys see here again, health history, assessment, everything is same in there. So you don't have to read that back again. But yeah, if something different, we'll stop again for sure. Vital signs, almost same, still same, right? That means again, we don't have to read the case study, but sometimes the case study include the new information. Maybe I'll show you in the next few questions. Then only you read about that, right? So here they give you third question is drag the option from the choices below. Again, fill in the blank I can see here. So what is the fill in the blank seems like? The client is at the highest risk for developing what and what. And these are your four options in here. Try your best, everyone. What do you guys think? Risk for developing what two conditions in here?
Respiratory
Ma'am,
failure.
respiratory failure.
Respiratory failure.
Respiratory failure, very good. Use elimination process.
Because
You
earlier
will
the
go in there
patient
right away. Yeah, sorry.
Pulmonary
currently
embolism.
patient is in the respiratory distress, so ultimately he will go to the respiratory failure.
Very good, very good. Now, what do you think between sepsis, acute kidney injury, and pulmonary embolism? Which one you think could be the next answer, everyone? Try your
Acute.
best.
Acute.
Elimination process.
Pulmonary embolism.
Okay.
Pulmonary
Any other
Because
embolism.
there
student?
is no infection, so sepsis should be excluded.
Mm-hmm.
Acute kidney injury, so it
Mm-hmm.
also must be excluded. The
Mm-hmm.
second priority option should be pulmonary embolism due to heart failure.
Okay. So pulmonary embolism, you think it's due to the heart failure? That's why? What do
The
you think
second
about the
priority option.
kidneys? What do you think about the kidneys now?
Yeah. Kidney. Acute kidney injury.
Okay, very good, Simarjeet. Why?
Because of fluid overload.
There you
Yeah.
go. There you go. So here you look at the semi, like you look between two options and think which one will be more possible, more faster as compared to the other. So right now, if they already give you like a fluid overload, that means we're gonna think more about them. Pulmonary embolism, I'm not saying that it cannot be happen. It can be happen as well, but it's not something at presently at this time as per the current situation of the patient, right? Currently, they give you fluid overload for sure, right? And definitely you want to think around that as well. So my second answer for this question is the kidneys. So
Acute
I'm just
kidney
going to
injury.
read a little bit more rational for all of you guys. So basically, I have a rationale in here. They said impaired gas exchange from pulmonary edema places the client at the risk for respiratory failure, which is your first answer. And then they said reduced end organ perfusion, eventually damaging all the organs. But because the kidney receive over 25% our cardiac output, so they are the most sensitive and often incur the damage first. So this is the another rationale in more in depth, just in case you guys looking the proper information in there. So I thought to read it for you at the same time. So I hope everybody understand how we pick up the answer for this question as well. Try your best for the next question too. See if you can answer me that question as well. So question number 4, I can see exactly health history so far. Nothing really changes in here. So again, we can skip it. If you remember that. Assessment, still same. Nothing new you can see adding up in here so far. Vital signs, okay, is it still same? Yeah, it's still same. That means again, we don't have to read this. Very good, right? But again, as I said, in real exam, watch it out. Look at the case study again very carefully when you go to the next question, everyone. You never know, they add up another tab there for you and you need to read that, like physician order, diagnostic test, lab results, so and so. There could be another tab as well. And sometime there is in the same tab, you will see additional information as well. So maybe skim and scan first and then think about it. So here I can see the next question is, if you see the pattern, we have anticipated and not anticipated. Something you think it's a good idea, you're expecting it, anticipated for this patient, something you're not expecting it at this time, right? You're thinking it's not required at this point. That is going to be your not anticipated right now. So let's try your best, everyone. Go along with me and think about the answer. The first one we have obtain the blood for the culture. Do you think we require blood for the culture at this time?
Not
Everyone?
No.
Not
anticipated.
No.
not
Not
anticipated.
required, so not
Not
anticipated.
required.
Very good. The second one we have obtain the sputum for culture. Do
Not
you think
appropriate.
for culture
Not
required
Not
that?
anticipated.
appropriate.
Not
Not anticipated at this
anticipated.
time. Very good. Prepare for echocardiogram. Do you think it's
Anticipated.
Anticipated.
yes? So
Anticipated.
anticipated. Draw the serum renal function
Anticipated.
test.
Yes.
Anticipated.
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 Very good. Should we give the supplemental oxygen right now?
Yes. Yes.
Yes.
Anticipated.
Anticipated.
89%, right? Obtain 12 lead ECG. Required or
Yes.
not?
Definitely.
Yes.
Yes.
Anticipated.
Yes.
Very good. Draw serum B
Anticipated.
type
Yes.
natriuretic peptide.
Yes.
Anticipated or not
Absolute
anticipated?
Anticipated.
anticipated.
Anticipated. Very good. See, I can see everybody find out this question really easy at the same time because I don't see any mistakes in here. But as I said, you can always stop me in between if there is any doubt, any questions for me. Okay.
Madam,
Moving
why
on to
we
the
need
next
ECG?
question quickly. Yes, Kulfam.
Madam, why we need ECG at this time?
Why we need the ECG at this time? So basically, heart failure can be caused by the myocardial infarction or acute dysrhythmia. So that is what we want to see at this point, just in case if it's going to be happen pretty soon, right? Does it make sense?
Okay, madam.
Mm-hmm. Okay, now moving on to the next one. The next one, oh, there's a new information right now. Did you guys notice? Lab
Yes.
results,
Laboratory
right?
results.
Now that means we have to read this information. Rest everything looks
EMG.
same to me, so we don't have to read that stuff back again, which is already same in there. But what is in lab results right now? Okay, they give you sodium, they give you potassium, they give you B-type natriuretic peptide, right? So once you see that, and you see the normal value they give you already in there, so you don't have to read this for this exam, right? Which is a good thing now. So 132, okay, sodium is low, right? And then potassium is high. No, this
Okay.
is normal. Okay,
Normal.
3.8. 3.8 is normal, right?
Yeah.
And then this is the less than 100 is normal. So this is 600. Okay.
Yes. High.
Hi, something going on? Something going
Heart
on,
failure.
right? There you go. But when you see the question, you think as per the question what you need now. I can see this is a prioritization question kind of thing right now, like comes first, right? The nurse has reviewed the lab results now. The healthcare provider diagnosed the client with a heart failure. There you go, which you already know now. Which of the following order should the nurse prioritize? What do you think? What we need to do first order in here and why?
Whole number.
Ma'am,
Madam,
Sorry?
administer
prepare for
furosemide.
echocardiogram.
Okay.
First we assess.
What comes first? You think that cannot wait. You already know the heart failure is there, but the rest of the things can
Ma'am,
wait.
administration of
Mr. Fusemide.
furosemide,
Fusemide.
Very good.
because
The
Three.
one
patient
who
is
pick up the
going
answer
to,
number three, administration of furosemide, can you please tell me the rationale?
Madam,
ma'am,
but
definitely
To
the
excrete
patient is
fluid.
Yeah,
going to
okay.
fluid
We'll go one
overload.
by one. So maybe I'll pick the Sammy first. Sammy, what is your
Ma'am,
rationale for this? Or Renuka
ma'am,
also, I can
already
see.
already we know the
Fluid will
patient
decrease
condition,
mental
and
capacity
patient
and
is
the risk
in
of
heart
failure will decrease.
failure, and he would might be in pulmonary. He can go into pulmonary edema. So
Mm-hmm.
therefore, is the first priority to administer any diuretics to excrete out his fluid. So
Mm-hmm.
therefore, he will be able to he would be able to take breathe easily, and his oxygenation system
Mm-hmm.
would be much better rather than just because of administration of furosemide. So that
Mm-hmm.
should be in priority.
Okay, why not the option number four? Because some students are also confusing four.
ma'am, but we give when furosemide, sodium also lows, and we
Mm-hmm.
have hyponatremia, 132
Mm-hmm.
sodium.
Okay. So what do you think, guys, on this one? He's saying loop diuretic also lose the sodium.
Potassium too, ma'am.
Okay. So what do you guys think on it? Can we still give furosemide or no?
Yes, ma'am, sodium can be optimized just
Mm-hmm.
because of sodium potassium channel, but we cannot wait for patient will lead to life threatening condition.
Very good. So you think in this way,
Ma'am,
right?
one thing that the furosemide is very
Yes,
important
Rehan?
because the patient is heart failure.
Mm-hmm.
The main reason behind that it causes pulmonary edema, and the other reason because the heart failure is the main cause.
Very good. Very good. So you think the main priority at this point. So those who are thinking about the sodium, right? What is the maximum gonna happen? Confusion and everything, right? What do you think, which is more urgent for you to save first? Get the extra fluid out from the body because you want to improve the breathing, shortness of breath, and everything in there, or you want to work upon the sodium first because you think it's low, right? This is how you guys want to think at the same time. I know it
Ma'am,
can lead the hyponatremia at the same time, but what is a more priority at this time? Get the fluid out,
fluid.
right? Or you think you want to just wait for it and think maybe an alternative option because you think the sodium is low. And how much is low right now? Is it too low? You think like it's too low, and I think it's not safe to give it. What is the sodium right now? 132, so it's just
132.
slightly low right now, right? So I think it's okay to give this medication at this time, and it's just 40 milligrams. IV I'm giving right now. I'm not giving too much doses to this client, the furosemide, that it can lead to suddenly too much hyponatremia in this patient, which you think it's going to lead to further problem. Confusion, that's the maximum, right? That's the maximum going to happen pretty quickly, right? But for me, working on the airway is the first thing right now because I want to treat the cause first to make my body looks better further, right? You can definitely give the sodium further as well if it's required right after that. But what comes first is work on the shortness of breath. This is how I will think about this question. I hope
Uh,
everybody understand. Any questions
ma'am,
further for me at this point?
but at we start, there is a risk of AKI. In a previous
Mm-hmm.
question, we can select risk of AKI as well.
There is a risk of what, sorry?
Acute kidney injury,
Okay,
AKI.
ma'am, and loop
okay.
diuretics is wasting potassium wasting diuretics, I think, not sodium, maybe.
Yeah, this is what
Or
I'm
both.
trying to saying. Like priority is not about the sodium right now, right? Now I think
Mm.
Gulfam is confused in the kidneys right now. Can you say the question back again, Gulfam? I want to try to understand your question again, sorry.
Madam, in previous question, we select the risk of acute kidney injury.
Mm-hmm.
So we give again furosemide to patient.
Mm-hmm.
Does it make sense?
Yeah, it will make sense because your loop diuretics is mainly gonna excrete the excess fluid from the body. You wanna relieve the pulmonary edema first, peripheral edema, like whatever is happened right now, and you want to improve the gas exchange for this patient first. That is your first priority to look at the airway. Okay, imagine right now, maybe I'll show you this question in a different way. Imagine, Gulfam, I'm your patient in front of you right now. You're working in a hospital right now with me. Imagine I'm telling you, or maybe I'm presenting right now shortness of breath at this time, right? And my sodium is also a little bit low at the same time, right? Which way you want to go first when you enter in the room? Do you think you will do something, whatever you can do to work upon my breathing right now, right? So I can feel a little bit better with my airway first, airway breathing circulation. Or do you think you want to work upon the low sodium right now, which you already checked before in the lab results before you come into my room, right? So the question is about, first, right? The question is not telling you like I'm not gonna look at the sodium or anything like now, but the question is main about what comes first. Now I understand your concern is furosemide will also reduce the sodium. Then why we are giving that? Because furosemide mainly excrete the fluid, excessive fluid which is not in there. It can also do a little bit reabsorption of sodium chloride, potassium back in the loop of Handley at the same time in the kidneys as well. So it's not gonna totally take out and flush out your sodium right away. It will take time to release that, but definitely fluid excessive will go out first, and that is why we want to give the furosemide. That is the reason behind it. I hope it makes sense a little bit right now. I try my best to convert maybe this scenario in a different way so everybody can understand. Any further questions for me, guys, before we go to the next question? All good?
Yeah, all good.
All good? Okay, perfect. Okay.
Okay, ma'am.
Now let's see the next question in here. Yeah, it doesn't really take your sodium out right away. Now, the next question I can see here, history, assessment, vital sign, lab results, everything is still same, right? Just to make sure everything is still same. That's why I'm making down slowly, right? Lab results is still same. Vital signs is still same, right? Nothing really changes in here. That means you're going to look at the question now. Now, if you guys see the question, select all that apply, right? Only pick that answer which you know. And I can see this is like related to maybe teaching something patient is discharging maybe right now. So 2 days later, client has improved now already after receiving scheduled medication, those two, Prils and furosemide, and is now ready for discharge as well. So patient is going home. The client is being discharged from on the this medication, this medication, this medication. Now you really need to recall these three meds together, who the pills are, what they do inside the body, LOL, beta blockers, and then your furosemide as well. And then the nurse has provided discharge instruction to the client, which client statement indicate the teaching was effective. That means you look for good statement in here, and that's how you know the teaching was effective. So let's see together. Number one says,
One,
it
two,
is the
five.
best. Yeah, it is the best if I take my furosemide first thing in the morning when I wake up. Good idea, bad idea, guys?
Good
Good
idea.
idea.
Good idea. Let's keep it in. The next one says, I should avoid eating pre-packaged food and over seasoning my food with the salt. Good
Good
idea, bad
idea.
Good.
idea?
Good.
Good
Good
Good.
idea.
idea, right? And then it says, I should contact my doctor or healthcare provider if I gain the
Yes, good
more
idea.
than
Yeah.
this much weight
Yes.
in a week. Good
Good.
idea, bad
Yes. Good
idea?
idea.
Good
Good.
Good
idea.
idea.
It is important to weight myself weekly to
No.
ensure that I'm not retaining too much
No
food. Is
daily.
it
Bad idea.
weekly or
Bad.
every day or every other day?
Yeah.
Every day.
This is something you want to think about it.
Dependent.
Weekly is too late. This is what I feel like it. What do you guys think? Should we do daily?
Yeah.
Yes.
Daily.
Yes,
Yes,
ma'am,
and
daily.
always remember daily same time, same clothing,
Same state.
same machine. This is how you teach the patient, right? So this is too late, weekly. Not a good idea, bad idea. Certain over-the-counter medication like antacids, they contain high amounts of sodium. What do you guys think? Good idea? This information that when the patient is trying to telling you, is it a good idea or is it
No.
a bad idea?
Bad idea.
Now, those who says bad idea, tell me why is it a bad idea? And those who say good idea, tell me why is this a good idea? Then I'll give you my answer. Try your best. Real me, I don't have your name in here. I can only see real me pad, like your cell phone name maybe, right? What do you think why this is a bad idea, you said?
Mm,
Ma'am, these medication
because
contain more
these,
sodium, and
Okay.
if we contain more sodium,
then
uh,
again, water retention.
water retention in our body, so
Uh-huh. Uh-huh.
it's
Okay, you want to think right now the patient already discharged and going home with these three meds together. Okay, case is gone. That was in hospital, right? Right now your patient is discharging on three meds. So based upon those three meds, you want to think if I'm as a patient, I'm telling you like certain over-the-counter medication like antacids, nurse, I know they contain high amount of sodium. So is it a good idea or bad idea if I say this thing to you? Do you think I understand the teaching or not?
Yes.
Yes.
Understood.
Now, what do you make? What does it make you to think yes, Rakhi? Do you want to clarify a little bit, Rakhi?
Ma'am, I think he have a some knowledge about the
There you
medications.
go. Keep it simple. Patient
Yeah.
is trying to telling you like this medication, nurse, it has this amount of high in there, right? So if the patient is giving you that much knowledge, that means patient know the information, right? like the patient really need to take it or not, and patient need to consult with the doctor about it. So here the patient is not telling you anything, I'm going to take it or not. The patient just give you general knowledge about the antacids, right? So it's a good idea. Patient know all the information what they need to know, where they contain more sodium or less sodium, right? So I'm going to keep this option inside because my patient has a good knowledge about it, and my patient know in the future they need to take it or not, right? Well, definitely you always teach them don't take the over the counter medication. You always consult with the physician. But here they just give you like the knowledge. The patient has a knowledge about the other medication, right? So I'm going to say it's a good idea to keep it in because patient aware about that. Are they going to use it or not, right? So I will keep it in as my answer key as well. So the final answer for this question is number 1, number 2, and then you have number 3,
Number
and then
5.
you have number 5. There you go, right? So this is how we do this type of question now. I hope everybody understand few questions today, right? I really apologize for a little bit short lecture today, but that's all about for today's class. We'll try my best to stretch maybe a different days for all of you, maybe probably 2 hours, right? But I really appreciate you come on the short time notice with changing in timing today and try your best to join with me so we can learn at least something together. And YouTube students, I also see your comments as well. Thanks for coming and participating at the same time. Does anyone has any question, any doubt for me before I leave the class today? No doubt, no questions? All good? Okay, if there is no doubt, no question, we'll see you guys back again tomorrow, and always keep watching my updates in the WhatsApp group about the next classes. Thank you so much, everyone. Take care and have a great
And
weekend, everyone.
Thank you, ma'am. Thank you
Yeah,
so
no
much.
worries.
Thank you, ma'am.
Thank
No
you.
worries.
Ma'am?